Start recording. There we go. Okay, so again, welcome everyone. It's again such a pleasure to see you. I'm so thrilled to have us all together in this particular way. So I'm going to talk today about attention. And I've been realizing lately, also I'm thinking about several new writing projects, probably now I'm thinking maybe 3 books. So um, because of that, I've been thinking a lot more about attention lately and how fundamental it is to our understanding of this work, particularly any kind of work that involves somatics, but particularly the moving cycle has a very central presence of our understanding of attention. So I wanted to do this class on attention. And also to say that it looks like there are some researchers that are starting to be interested in attention and the body and movement and their relationship to each other, particularly in promoting well-being. So it's very good to see how we are, how the moving cycle is anticipating this research and how to understand what is going on there. Okay, so I'm going to put up a PowerPoint just to help me it helps me to actually organize what I want to say next and all that. I'm going to post the PowerPoint as well for you, and I have in it more slides than I can manage in the 90 minutes. So that's why I just wanted you to have access to the sort of the written word, so you could, particularly those of you who English is your second or third language, you can sort of take some time and go over the words of it at your leisure. Okay, so now I'm going to put on my okay, let's see. Oop. So like I said, I have more slides than I know what to do with here, but that's because I wanted to just share them with you. And we won't necessarily go over all of them together today, but you'll at least have access to them. I also have a reference section at the end that is a lot of the readings that I used to make this this talk. Oh, sorry, I have to turn my heater off. Okay, so let's move forward and just start with this question of what is attention? How do we even define attention? And so the dictionary, of course, is just very straightforward. And it's that you're taking notice of something or someone. And it's, in English, we say it's the regarding of something as interesting. In other words, something gets your attention. Something becomes figural from the ground. So something kind of comes into a figural relationship, and the act of paying attention to it makes it figural. And so it's somehow interesting or important. And this is important because from the perspective of the brain, paying attention takes energy. The brain is really having to work to pay attention to something. And so this is why, from a kind of evolutionary standpoint or a Darwinian standpoint, the brain is always making decisions about what's important. And our bodies actually give, the rest of our bodies give the brain the input to help it decide what's important. And we'll look at that more as we go along. Now, Wikipedia is coming in and saying that attention is, it's both behavioral and cognitive. In other words, it's both what I'm doing and it's also what I'm thinking or processing. And it's, again, a selective process. I'm excluding something and including something. I'm selecting something. Um, so that's some kind of information. And attention is an act of that selecting, but what also happens then is that you're ignoring something else. Something else goes away in order to select something in your attention. So just a little bit about the psychophysiology of attention. Some people say there's 3 types of attention, some people say there's 4, but you can see from this list how the moving cycle gets started on training attention. Because first we have this type of attention that's called focused. And so that's, again, the ability to kind of create a beam of attention onto a stimulus. And then the second is sustained attention, the ability to actually keep your attention there. And this is particularly has to do with a kind of length or amount of time that you pay attention. And then there's this third type of attention that's called selective. In other words, you have to keep selecting what you're paying attention to. You have to keep choosing to keep it in the foreground, even though there are distractions. There's other noises, there are, lights, there's people talking, there's all this. And so if you think about like having a conversation in a crowded cafe, you are tuning out all the other stimuli and you are continuously selecting hearing your friend's voice. And so these are all mechanisms that are very important for attention, and they give us a sense of what the skill of attention is about and what actually happens when those skills either are not developed well, as in, let's say, developmental trauma, or that they are interrupted or suppressed. Those skills are suppressed because of things like traumatic events. And so that's why in the moving cycle, we get very interested in not just what you're paying attention to, but the act, the ability to pay attention, which of course we know is compromised in situations like trauma, and it's also compromised in attention deficit disorders. So this is, again, I think a very fundamental idea for us. And so the next thing is the characteristics of attention. So it's selective, which we said before, right? We are always selecting what's important. It's shifting. And this is interesting because I got the word shifting from a book, actually, but it's actually a description of the oscillation of attention. And so the word we use is oscillation, but it really is acknowledged in neurosciences, this idea that attention is always kind of going here and there. And so there's almost a tension between this act of choosing something and staying with it and attention's natural inclination or natural movement of shifting. And this is probably, again, a very evolutionarily important thing because we have to make sure that, there's no danger or there's not something out there that's more important. So that shifting nature is a part of it. But attention is not just a cognitive phenomenon. It's also emotional. We are selecting our attention around emotion, our own emotion, and reading the emotions of others also. It's also has to do with our instincts. Like I was saying, we have an instinct to pay attention to, let's say, a sudden noise or a sudden movement. That's very instinctual and probably very good form of defense. But also our attitudes, our ongoing attitudes influence how we pay attention and what we pay attention to. Attention also has a narrow range. We can't pay attention to too much at one time. It really does have a one thing at a time kind of range. And what attention does is it increases the sort of the details of what you're attending to. So there's a clearness or a richness to the stimuli when you pay attention to it. But the other thing that we'll talk about more in a minute is that it needs motor adjustment. So this is, in other words, it needs the moving body to operate. And this is why, for instance, as we fall asleep, we stop paying attention to anything. That's because our body, as our attention is going away, our body is relaxing. And so there's really a strong relationship between muscle activity or muscle tone and attention. This was first discovered by a physician named Edmund Jacobson, I think in the 1940s or something like that. And he's the one who developed the method or the technique called progressive relaxation. And so he was really noticing that there was this strong relationship between muscle activity and attention. And so what he did was he trained people to alter muscle activity as a way to train attention and as a way to promote things like relaxation. So it also, attention is not a simple thing in terms of the brain, in terms of what neuroscience understands. That's because it involves many areas of the brain. It depends on the type of attention. And so the other issue is, in order to pay attention, let's say, to an orange in my hand, I have many different sensory inputs that are trying to synchronize in order to get this sense of orangeness. So there's the weight of the orange in my hand, a kind of kinesthetic sense. There's the shape of it in my hand, which is also a kinesthetic sense. There's the temperature of it. There's the smell of it. There's the color of it. All of that sensory input has to be synchronized and kind of put together in order for me to say orange and really pay attention to the orange. And so a lot of times what happens when people can't put their attention on something, it's because those different sensory impressions are not synchronizing. And this is what they think, for instance, is happening with ADD, ADHD, attention deficit disorder, attention deficit hyperactivity disorder, is that inability to synchronize that sensory input. So the orange kind of doesn't make sense, right? Literally doesn't make sense. So it involves all these different parts of the brain, all the sensory cortices, we call them. Plus, it also involves our memory, like, have I experienced this before, this orange thing in my hand? It also involves beliefs that I have about oranges or round orange objects, my emotional history with oranges. And it also involves, as I hold the orange, I also am using what's called my premotor cortex. And when we talk about premotor cortex, what it means is there's this part of the brain that just gets ready for moving, gets you ready for moving. And the premotor cortex is going to pull together, very similar to the sensory that I was talking about. It pulls together different things in order for me to move as a response to that orange. Like, let's say, to come and take a bite out of it, or to smell it, or to hand it to a friend. So all of these different motor responses to the orange are having to be coordinated. And so the premotor cortex actually pulls everything together and says, okay, now I'm gonna have to use this muscle and this muscle and this muscle. These two muscles have to fire at the same time. This one has to fire first. This one has to fire last. The premotor cortex, in other words, is organizing movement before it happens. And we'll see how important that is in a few minutes. And so it is very important that we understand how this motor part of the attention process is very critical. And so, but again, you can see that attention is involving a lot of different parts of the brain, all these different senses, all these different motoric areas. It's also, for instance, there's one part of the brain called the fusiform gyrus that is actually highly specialized for just recognizing faces. It really lights up as soon as we open our eyes after we're born. And it pairs the sound, for instance, of your mother's voice to her face as you look at her as a newborn. And so I'll show you a photograph about that in a minute. So the ability to recognize faces and relate to them is so important evolutionarily that we have this specialized area, the fusiform gyrus, just for facial recognition. Of course, this area is a little bit dormant in people who, excuse me, are blind from birth. But from early infancy onwards, our brains are actually wired to very strongly orient towards, excuse me, people's faces. So this will be obviously important for us as clinicians. Also, the other thing that we understand about the psychophysiology of attention is that it becomes habitual. And that's, of course, could be good habits or bad habits or both all the time. And so when we say habitual, what we mean is it starts to happen automatically before you're aware of something, or even without your conscious choosing or conscious understanding that that's what you're paying attention to, or that's why you selected something to pay attention to. So attention can become very habitual. We see this in trauma quite a bit, but we see it in, relational dynamics as well. There's a way that you become habituated to paying attention to this and not to that, and to pay attention to this person or not that person, to prefer to attend to one stimuli over another. So this is actually important in the things like cognitive behavioral therapy, which has a lot of sort of training in it about your behavior, because one of the things that they get really interested in is how can I not pay so much attention to, for instance, my negative thinking. And my negative thinking, which contributes a lot to my depression, for instance. If I am really habituated to a kind of running narrative of negative thoughts or negative interpretations, then that habit has a tendency to pull me into depression. And so we're seeing that again, attention is a very critical phenomenon. And if we can get to the root, that's like, if we can work with attention, we're getting to the root of things like depression or, excuse me, anxiety, things like that. And this is, of course, it's not talked about exactly like that in cognitive behavioral therapy. Sometimes it is, but most of the time they're just looking at the behavior, the automatic behavior. But we want to realize that the automatic behavior, that habit, that behavioral habit, has a root in an attentional habit, in terms of we have habituated what we make important, right? What stimuli we make important. We have a habit of that, and that habit causes us to perceive the world in a certain way because we're selecting for those stimuli. And then that selectivity gives us a kind of an emotional tone that then itself becomes familiar and practiced and habituated. So as we're sort of getting towards this idea of why attention is so important, in the moving cycle, we see that we're going to this root of the body and how the body is moving and sensing and breathing and relating, how that is the method by which we're going to work with attentional skills and habits, which then work on different psychological issues. Okay, here's just a picture that I got out of a neuroscience book that shows they put like a little eye tracking device onto an infant. And this is an infant looking at its mother. And so you can see that the infant, for one thing, is looking at its mother's face. Look at how all of those lines are like inside of her face, and how so many of them go between the triangle of the eyes and the mouth. That these are so important, so salient, or so important for the infant to understand how its mother is feeling, how its mother regards it, that we see this looking pattern very, very, very early on. Okay, so there is in neuroscience a concept that I just wanted to bring up because it's related to what we're interested in. And neuroscience calls it the binding problem. And so I've actually already talked about the binding problem a bit. Why they call it a problem, I don't know. But the idea is that in order to see something, like they say, a grasshopper on a table, all these different regions of your brain have to be active, one for just the color, the size, the location. And so the question is, how does the brain synchronize or pull together these separate phenomenons, separate neurons, right, in the brain? How does it coordinate them so you can say, grasshopper? And so a lot of attention is not so much what's coming in terms of stimuli, but how those stimuli are being synchronized or bound is past tense of bind, how they are bound together. Okay, so this is a really critical phenomenon, is this idea of binding different sensory and motor stimuli together. And that's how we make sense of our world. That's how our world appears coherent to us. When those things bind together, they're called assemblies. And they've talked about it being like a ballet of neurons. And so only the assemblies of neurons that have cooperated especially well possess enough strength to reach our consciousness. So in other words, that binding has to actually really be in good shape for something to get our attention. So this can be, I guess you could say it can be a problem. If that binding is not well done, we can't actually pay attention to something, okay? And so conscious perception, then what we're aware of, is only occurring when all these different incoming signals are processed in such a way that they become synchronized with others. And so this is a kind of, again, a kind of this sense of this beautiful movement, kind of symphony that's occurring amongst the neurons in the brain, both sensory neurons and motor neurons and memory neurons and emotion neurons, etc., all kind of dancing together as we get ready to move in response to that. So let's, take what I've been talking about so far and look at then how is then attention a really strong body phenomenon? Because again, most people are thinking that it's a cognitive or just neurons, but those neurons are dancing and synchronizing because of the rest of the body, because what's happening in the rest of the body. So let's take a look at that. So one of the things that scientists know is that moving stimuli capture more attention than non-moving stimuli. In other words, our brains are actually instinctually wired to pay attention to movement more than stillness. Isn't that interesting? I think it speaks later on, it's going to speak to the issue of relationship. And I'll say more about that. So attention requires movement, or at least it requires what we might call muscle contraction. So in other words, in order to pay attention to something, we actually have to focus the eyes, and the eyes, I don't know if you know, but the eyeball is the way it focuses on something to bring something into focus is actually muscles that are attached to the eyeball contract to change slightly the shape of the lens in the eyeball. And so the act of literally just focusing your eyes is a muscle contraction. But also the head has a tendency to turn. This is all very instinctual. The head turns towards stimuli. The spine has a tendency to straighten as we pay attention. And the ability to sustain attention requires muscle tone. This is from the work of Edmund Jacobson that I was telling you about before. This attention requires muscle tone. If you remember your anatomy, there are a lot of tiny little muscles that are only about 1 or 2 inches long that are between each individual vertebrae of your spine. There's about 5 or 6 on each vertebrae that just connect to the next vertebrae. And these tiny little muscles are actually the bulk or the large part of our muscle tone in terms of what we call postural tone. In other words, the ability to sit up straight is largely, hopefully, taken up by these postural muscles. And the postural muscles, those little tiny guys next to the spine, along the spine, are strongly related to attention. In other words, when they relax, our attention tends to go away. Our ability to pay attention tends to go away. If they're really, really tight, our attention tends to also get a little bit strongly narrowed and diminished. It's when the muscles are sort of in a state of tone, in that middle ground, that our attention can be the most powerful and the most effective. This is likely why most meditation traditions ask you to sit on a cushion and to sit straight on a cushion without a backrest. So they've intuitively understood that postural tone of the straight spine or relatively straight spine is going to really maximize your ability to pay attention. And if there was any one tradition that trains attention, it's meditation. It's an amazing system for training attention, and I highly recommend it, actually. So also, as I was saying, the attention tends to get lessened both when we are in a state of hypotone, that's like really big relaxation, right? Or in hypertone, when we're exerting too much effort to accomplish a task, when we're actually tense, really overly tense. And so attention is, we might say, disturbed or at least changed when we're in hypertone or hypotone. And certainly we need the hypotone in order to stop paying attention to go to sleep. So it's actually really important. Hypotone is very important. Hypertone is also very important. Hypertone tends to make you alert. And we need sometimes to be alert to understand something that's going on or respond to it very quickly. So it's not that hypotone and hypertone are bad. It's just that they are a way of altering attention. And we're going to look at how we can do that on purpose in the moving cycle. And so, however, we don't want our muscle tone to be constantly hyper or constantly hypo, because our maximal sort of relaxed ability to pay good, high quality attention lies in that middle ground called tone. In other words, when the muscle is active, but it's not tense. And so that's that kind of tone. So tone is actually really critical in our understanding of the most optimal attention. And that's probably also, again, the kind of thing that is used in meditation traditions to find that really lovely critical middle ground for meditation. So I found one article that talked about body attention patterns. So I thought it was really interesting in the first place that they called it body attention patterns. Could be related to personality defenses. So they did a study that showed the relationship between what you're paying attention to and what defenses you are employing, how defensive you feel about X or Y, and whether or not you feel this, how important it is to defend yourself, is related to the state of tone that your body is in, and therefore what you're processing in terms of the need for defense. And by the way, the reference for that is going to be at the end of this slideshow. Okay, so there's also evidence that learning to pay attention to your body, the sort of the interior of your body, particularly interoception, which is technically called interoception, can relieve stress and reduce anxiety and increase emotional intelligence. And so now we're seeing that the body is not only producing attentional states, but also our ability to pay attention to our body can really affect our ability to pay attention to different things, which then can relieve stress, reduce anxiety, etc. So let me take a pause for a minute here and I would say there's probably, it would be nice if we could, if anyone wants to ask a question, just to unmute yourself and go ahead and ask or make a comment before we move on. Anyone want to say anything? Elisita?
Yeah, thank you for this first part. It was interesting for me because when you started to speak about the motor component, which is important,
Yeah.
I was thinking of meditation, because in fact you don't move so much.
Yeah.
And so it was really enlightening that you said, but this the spinal postural movement is so important for that. So that was good that came.
Yeah. Thank you. Yeah, because, and this is something that I'd love everyone's input on this, because one of my complaints about meditation is also that there's not moving very much. I mean, there are different kinds of moving meditation, and certainly things like authentic movement could be seen as a kind of moving meditation. But in the moving cycle, we would want to appreciate and even use that kind of relative stillness of meditation, sitting meditation, as one form of training, but not the only form of training. In the moving cycle, we're very interested in the use of movement as training attention as well. And so this is something that I think is very important for us, and to me is a huge contribution to our understanding of what a contemplative practice is, right? So, yeah.
Can I add just only because I often have difficulties with meditating in this very still or for hours long period. So I always think of me when I do my rituals or so moving. For me, moving has much more to do with meditation also, and being really focused on what part of my body is moving. And so it's another, I think it's another type of attention also.
Yes, exactly. Yeah, exactly. Thank you. Any other quick comments before we move on?
Christine, we have also, like in the Laban work, the spinal movements.
Yeah.
And sometimes I really use this spinal movements to get people relaxed, and then they come naturally into a stillness. And then they find an organic way of sitting up and having this attention muscle present in a way that you never could organize it from a technique.
Yeah.
But it's a natural flow. It's like really stimulating these small muscles. And then really working with the weight factor in a very subtle way around the spinal movements.
Yeah.
And there is a natural drive in the body that organizes itself then into like a real precise attention, and people come up after a while if you let them be in it.
Yeah.
That's a nice way to experiment more with it.
Yeah, that's lovely. That's a lovely sort of very direct practice to understand this relationship of the spinal tone and attention. So thank you for that. That's great. Yeah. Okay, so I'm going to go forward, and hopefully we'll have more time at the end to talk. So let's look specifically at the moving cycle and how the moving cycle is understanding some of what we're looking at here. So a lot of therapy really is interested in what you're paying attention to, right? That you're paying attention to a certain person or something inside you or something that you're attending to. In other words, a lot of therapy, and for good reasons, is examining what you're paying attention to, the object of your attention. But in the moving cycle, certainly we do honor what you are paying attention to, but we're seeing that as less important. What you're paying attention to is less important than the architecture of your attention, than the way your attention is structured, so that it's almost habituating you or forcing you pre-consciously or unconsciously into paying attention to that object, that stimulus. In other words, the architecture of attention is what the moving cycle gets very interested in. Similar to what Ute just said about in the Laban work in the spine, there's that attention to the structure or the architecture of attention itself, not quite so much what you're paying attention to, because if you change the architecture, what you pay attention to becomes more free, right? Becomes more kind of a choice rather than a feeling of instinctual need to pay attention to one thing rather than another. And so we're really directly working with the architecture of attention. And I oftentimes, call it the attentional muscle, so that we loosen attentional habits that are the result of attentional wounding, and that we as therapists become, or artists or teachers, become attentional athletes. And we actually, in a sense, promote attentional athleticism. It doesn't matter what sport you practice, right? Whether it's art or therapy or teaching, but that athleticism is what we like to train in the moving cycle. So that attention is something that is a very powerful exchange between the facilitator and the mover. And that the strength of the attentional architecture in the therapist and in the client, let's say, is the delivery system for healing. And so we do that through a lot of training in the oscillation of tension, because attention naturally moves here and here and here and here. We start to use another principle of the moving cycle, which is that which we were doing habitually. We, instead of trying to get rid of the habit, we do the habit deliberately. We do the habit very consciously. And that consciousness, putting the consciousness in with the movement or the sensory processing, loosens it as a habit. And so we have then the capacity to go down different pathways, not just the habitual attentional or movement pathway. And so the oscillation of attention, as you remember, from in to out, from panoramic to narrow, from one sense to another, and also controlled attention and free-flowing attention, are what we train again as the architectural qualities of attention, rather than paying attention at this point to, oh, what are you paying attention to? That's not the question. The question is, how is my attentional muscle forcing me towards certain stimuli, forcing me away from other stimuli, forcing me towards certain actions and away from other actions, right? Okay, so we also in the moving cycle emphasize what I call open attention. By the way, that term is also used in a lot of meditation traditions, open attention. And it's the process of sustaining, here's that other characteristic of attention, of sustaining attention, usually to a body state, right? Or to, let's say, looking at someone else or looking at another stimuli or listening. So it could be out or it could be in, but oftentimes we do want to make sure that the person we're working with can pay attention interiorly as well as exteriorly. and to land your attention on, let's say, your breathing, okay, as an example. So we sustain attention onto breathing without, and we're trying to postpone meaning making. Remember that term from our training. We postpone meaning making. We try to just hold it in our attention without going into any kind of interpretation, what it means, any kind of judgment, this is good or bad, or any kind of control, I have to do something about this, right? So we just hold it and care for it without any kind of judgment or action. And what that does is it kind of loosens and slows what I'm going to talk about in a minute, which is called the appraisal process. Appraisal is actually a neuroscience term, and I'll talk about that in a minute. But it means kind of about the meaning that we ascribe to what we're attending to. So it loosens and kind of slows and kind of opens up the appraisal process so that we can be exposed to the possibility of it on its own changing. We don't have to force change, but it might change on its own as it is allowed to be more in a state of tone in the body. So again, what this also does, this kind of loosening of that attentional grip, the holding of attention in a certain way, and making the appraisal process very sort of stereotyped and habitual. We loosen that so that we can engage in what, of course, Freud called the free association process. And so Freud, you know, this was one of Freud's areas of brilliance, was this idea of free association, because he understood that you had to loosen attention in this way. And that when attention loosened, for him it was hypnosis and lying down and just talking, right? But he did it that way, but we want to make that much more open and broad, and so that we're doing bodily free association. And so what we do is called body free association. Rather than explaining, we're allowing the body to really hold something in our attention and then just notice what comes up. A sensory stimuli, an urge to move, a memory, an emotion, an image, a sound, a word. All these things are very related to Freud's concept of free association, but it's really a phenomenological experience. It's a direct experience, not just thinking, right? It's a direct physical process that we're doing with this body free association. And that's, again, the other way that we're working very directly with attention. And of course, we also, in the moving cycle, just like many other systems, we emphasize paying attention to things that are very crucial for our well-being. So this is breathing, moving, and sensing, which of course I've called the therapeutic triangle, as a way to access information from bodily states more than cognitive states. And so we're really working together to start to be able to pay attention to stimuli that are not in the attentional habit, right? We're starting to open up so that we can pay attention to stimuli that may have been excluded or suppressed because of an attentional habit. And when we can pay attention to something that's actually going on, that's different, then we expand our consciousness, we expand our choices, we expand the natural healing capacities of the body to take care of itself in a natural way. Okay, so I just threw this in because, you know, there's Freud in his couch. This is, by the way, from a museum And that is a wax figure of Freud. Okay, so now I promised to talk to you about the appraisal process. And so again, this is a neuroscience term that I think we want to pay attention to. Sensory information is always classified or appraised and given meaning. In other words, one of the jobs of the central nervous system is to do this appraisal process, which kind of says, okay, what is this? What does it mean? And what do I do about it? This is one of the important pieces of work of the central nervous system, is the appraisal process. Have I experienced this before? Was it a good thing or a bad thing? How did I respond to it? Was that effective? All this is going on unconsciously or pre-consciously before I'm even ever aware. The appraisal process goes on before I'm ever even aware of the stimuli. So it goes on before I'm actually aware of the stimuli coming in. I've already started to appraise it. And so appraisal technically is to kind of figure out what something is, the quality of it, how important it is. It has two main qualities to it, which is one is sort of a cognitive appraisal and one is emotional appraisal. In other words, how do I feel about this? Given this and that I've experienced it before, how do I feel about this emotionally? And so those two things, usually they need to work together. And so we'll look at this more later. So there's what's called primary appraisal and then secondary appraisal. In other words, primary appraisal happens first, and then you have secondary appraisal. And so the primary appraisal is, what does it mean? And secondary appraisal is, what do I do about it? And so what we want to realize is that secondary appraisal is already starting to happen in the premotor cortex before we are ever aware. So in other words, we're already organizing towards what to do about this in our bodies as we become aware of the stimulus. So let's go a little bit into another area, and then we'll kind of put it all together. And this is something that we talk about a lot in the phase 1 and phase 2 of the program. And that's what I call attentional wounding. In other words, we can understand that young children or children can become wounded by their relationships with others, with particularly adults in their lives. And what I get very interested in is how the different relationships that are going on are actually training, they're not so much about the specific incidences or things that happened between people, but how interactions with people are training your attention. In other words, they're training what to pay attention to, how to pay attention, the mechanism of attention, how you do it, when you do it, etc. And so, in other words, your early interactions train your attentional architecture. And sometimes that attentional architecture then becomes very wounded from your interactions with early interactions with caregivers. And so we might call this a form of developmental wounding to the architecture of attention. So it's telling us what to not pay attention to, what is more important to pay attention to, how long we pay attention to it, and how we appraise it. So for instance, in an alcoholic family, the child learns to pay attention to, is dad drunk, let's say? Is he only a little bit drunk, or which is scarier because then he can be abusive? Or is he really strongly drunk in which case it's probably better because he doesn't pay attention to me when he's really drunk. And so that attentional process gets very focused outside of me. What I feel is not important, right? What I feel isn't important at that rate. What's really important is whether or not dad is going to feed me or hit me or ignore me or whatever. So my attention has to be really highly developed out here. And so I'm attentionally wounded such that I go into my adult life paying a lot of attention to other people and what they are and aren't doing, and very little attention to what I'm experiencing, because what I'm experiencing isn't important. And so this is this attentional wounding that I feel is very, very important, because it's not so much about, you know, any one situation in one's adult life, but the fact that I'm clueless about how to pay attention to myself. And I feel anxious if I'm not paying attention out here. Okay, so the type of wounding is really taking place largely, again, unconsciously and non-verbally. It's a lot about how we're looked at, how we're held, how we're controlled in terms of parental attention. In other words, I will pay attention to you if you do X. I won't pay attention to you if you do Y, right? And so this is how that wounding takes place. And I've just identified a few types of attentional wounds. There's probably more types, but this is what I've identified so far. So critical attention. This is my poor dead mother, because I use her as an example quite a bit. But I used to get anxious when she would look at me, because my experience was when she would look at me, some kind of criticism was going to happen next. You know, there was something about me that was, you know, she needed to comment on that I wasn't doing right. And so I actually experienced attention as something that was suspicious, because I was kind of going to brace myself for being criticized. And so it actually took me a while to be able to tolerate the gaze or the look from people. That people just looking at me very directly was very anxiety producing, especially women, of course, and especially older women. So constant attention, it's actually very invasive or intrusive to have a lot of constant attention. We see this sometimes in children. I know that like when my son was about 4 years old and my marriage was in trouble, what tended to happen was my husband and I weren't paying attention to each other because there was so much conflict there, and we poured all of our attention into our son. And it actually became really burdensome for him. And it took me a while to realize that's what we were doing. And so that can happen, that one person gets all the attention, and that attention doesn't allow them a sense of privacy. It doesn't allow them a sense of, you know, what I think Winnicott said, going on being, right? That I can be okay even when I'm not being paid attention to, that I can play by myself, for instance, and I don't need someone to watch me play. This is a very normal part of development and a very important part of development, that I can go on being. Sorry, I'm going to crack my spine here. There we go. So constant attention doesn't give me that sense. And so it can be a really important attentional wound. And of course, neglect, just literally not being paid attention to, just being left, right, out there and not attended to enough. Also, chaotic attention. This means that you can't predict when you're going to be paid attention to. I remember I had a client whose parents were methamphetamine addicts, and he could never predict when they would be very actually attentive and fairly good parents and when they wouldn't. It was very unpredictable. And the last form is called conditional. So I'll pay attention to you if you, and I won't pay attention to you if you. And so what I'd like to suggest, my hypothesis, is that these attentional wounds are related to attachment disorders. And so insecure attachment, I think, is strongly related to attentional wounding. And I haven't seen anybody else saying that, but so that I just have to say that's my hypothesis. But I get very interested in how these kinds of attentional woundings create a problem in normal attachment processes. And I just had to throw in a picture of me and my infant son. And you can see that kind of gazing and the kind of body attunement where we're both smiling, we're both looking at each other, we're holding each other. He's kind of feeling, his body's kind of shaping to my legs. So you can see this kind of attunement that's body to body, that doesn't have anything to do with words, right? It's just this body to body shaping and attuning that's multisensory. And this takes us to some of the attachment research, where in this first scenario, in this very important research that was done, it was called the still face research. So first, for about 2 minutes here on the left, the mom plays with the baby and they just have fun back and forth. Then the mother is instructed in the middle panel here to just sit there with a still face, not letting anything show on her face, not moving and not doing anything in her face. So a securely attached baby will try to get the mother's attention. And you can see this baby, very cool, it's just grabbing its mom's shirt, you know, hey, you know, I want your attention. But it also will try to be cute, right? It'll smile and gurgle and try to, you know, hello, I'm here, I want to play. And so if she does that for too long, and 2 minutes is too long for a baby, the baby starts to protest. It might cry and shout and get agitated. So that's a securely attached baby. But what they found was that infants that had depressed mothers, and they were speculating that depressed mothers actually had this kind of still face going on very normally. Babies get used to this and they often sit very quietly. They're kind of like, okay, this is happening, there's nothing I can do. So they just sit quietly. They also, in this third panel, the one on the right, you can see this is a stranger and the baby is actually responding to the stranger. They're actually able to play, but in an infant of a depressed mother, the infant doesn't actually respond to the friendly gestures of a stranger. And so that's just a little bit of the research that's kind of around what we're interested in. And here's from my Buddhist teacher, Thich Nhat Hanh. He said that attention is like sunlight and water to a plant. What we pay attention to will grow. And so what he went on to talk about in those kinds of situations, that he talked about contemplative practice as a way to water. Well, he said we have in our, he called it store consciousness. I was never quite sure if that meant subconscious or not. I'm not sure. But he said we have the seeds of all the different human possibilities for being Pol Pot or Mother Teresa or Gandhi or Stalin or, you name it. We have all these seeds in our store consciousness. And when we're children, some of those seeds are watered and grow, and some are not watered and they don't grow. And so when we become adults, for Thich Nhat Hanh, he said that what contemplative practice was, particularly sitting practice, but also he had a lot of moving practices, walking meditation, eating meditation, everything. He got into all kinds of different everyday actions as meditations. So he said in all of those meditations, what you're doing is, as an adult, your responsibility is to water the seeds that need watering and stop watering the seeds that are causing suffering. And so that's how Thich Nhat Hanh really, in a sense, was really talking about attention, how you pay attention, and that what your job is, what your adult job is to water certain seeds, stop watering others, and do that in your interactions with other people, as well as within yourself. And so that's partly my interest in attention is from his influence. And so here's just a short list of how we use attention in a moving cycle session. So just in general, to dissolve old attentional habits through this physical free association process, this whole postponing meaning making, etc. But we're also forming new attentional habits. And we're doing that through the moving, very conscious moving body. That movement becomes very deliberate and very conscious as a result of this kind of attention and working with emerging associations. And so we're also seeing it as a factor in the therapeutic relationship. So it's a delivery system. Attention is a delivery system of an attuned and secure therapeutic relationship. So if I, as a therapist or a teacher or an artist, have this very secure, open attention, and I am doing that in the midst of my relationship with the person I'm working with, then that really generates the architecture of a secure relationship. And it also creates an environment, an attentional environment that the client can benefit from and learn from and rest into in a way that really holds them and helps them to open up their attention and work with their attentional architecture. So it also, again, heals attentional wounds. How we are looked at, held, related to is part of that therapeutic relationship issue. But also it helps us to access and work with what we might call peri-conscious states. In other words, this is similar to Freud's idea of how he wanted to access the unconscious. And we are accessing this root architecture of how attention is selected, how attentional stimuli are selected. And we're just kind of opening up so that the root issue of how we're paying attention starts to then select different attentional stimuli. And then we benefit from that opening up of an attentional habit and being able to attend to different stimuli than before. Like Thich Nhat Hanh said, we're watering the seeds of desired states. And so there is some research in here. So again, there's a strong relationship between postural tone and attentional clarity and focus. It tends to lessen rumination. Rumination is thinking about something over and over and over again, kind of getting caught in thinking. But also it affects judgment. And those are some of our researches. Martial arts training has a tendency to lessen ADHD, attention deficit. So again, that sense of tone, right? The sense of finding tone in the body, particularly martial arts that that can allow for you to feel ready, but not overly tense. A lot of martial arts training, even if it goes into these really maximal efforts like karate or something like that, are still training you to have tone, potentially a lot of tone, but also to not have excessive tone. And so that is has shown to be helpful for ADHD. And it's also now seen in different research that body movement influences cognitive performance. So how your body is moving or not moving in certain parts of the body and the whole body affects how you think, what you're thinking about, how you can sustain your thinking. So there's some lovely work about how the brain knows what you're doing before you do. And this has to do with this pre-conscious, paraconscious sort of, again, architecture that's going on before you're actually conscious. I think I won't go into this too much because we're kind of getting on in our time. But so you can go through this on your own, but it's basically the idea that there's a lot going on before we're ever aware of a stimuli, before we're conscious of a stimuli. A lot is going on. So any kind of therapy or artistic discipline or learning discipline has to really have some method of going down into that root pre-conscious architecture. And that's what we're talking about in the moving cycle. Of course, again, it's what a lot of different therapies understand, but some don't. So we want to really also be careful to understand how much that is a phenomenological process. In other words, it's about what you're doing right now in the room with the therapist. It's, as we oftentimes say, in the moving cycle, it's making that transition to from talking about something to actually experiencing something. We have to work with direct experience in order to get to that root, to get to that attentional architecture. We have to actually do something together experientially. Direct experience is what gets at that. Okay, so a lot of these now are just some quotes that I find interesting, but we don't have to go through. And there's my references for a lot of what I was talking about. But let's go ahead and talk about what you think about this. We have about 12 minutes before the end of our Zoom class. And so I don't know if you know how to do the raise hand function, or if we just want to try, you know, we've got 23 people here. Let's try people just going ahead and starting to talk and see if it works. Who wants to say something? Uta, if you want to say something, you need to unmute yourself. Just saying. So remember, if you want to speak, make sure to unmute yourself. Yes, Elisita.
Hi, Christine, again. So first of all, I really want to thank you for your clarity of all this. And it's funny, I told you that I'm out of the moving cycle so long, but it all came back so quickly because I
Yeah.
recalled also, especially in this attention training with you, I recalled it so well, and it fits well into my practice, even though I don't practice so much at the moment.
Mhm.
But so it's a real pleasure to have had this
Ah.
very clear
Uh-huh.
structuring, and it makes a lot of sense to me.
Super. I'm glad to hear that.
Thanks.
Yeah, good. Who else would like to comment, or particularly anything from your own practice or questions?
I have a question about how this, if you could just say anything at all about how this relates to the reflexes, developmental reflexes that, occupational therapists often are working with.
Yes, this is hi, Nisha.
Hi.
Hi, this is a really important question, and I just have to start by saying not nearly enough is known about it. There's just not a good sense of how they are related from a research standpoint. So what I would say about it is just going to be my thoughts on it or my ideas about it. And I also have to say I haven't looked at the research on this lately, so it's possible that something is new and I'm not aware of it. But I think there's actually a strong relationship between early reflexes and this attentional architecture. Certainly, I think people that have done body-mind centering training are going to really strongly understand this. And it's possible that, I know we have a few people who have BMC training here who might want to talk about how Bonnie sees it. But the idea is that part of what movement is doing in early infancy and early childhood is to use reflexes as a way to establish movement architecture. And so my sense is attentional architecture is developing within the movement architecture that's occurring, that is a reflex lays down, it enables certain kinds of movement, and then those movements enable certain more complex reflexes to lay down and then support more spontaneous movement or more directed, shaped movement. So I think that they're actually on some level in my mind, I think they're actually the same thing, that attention and movement at that moment are the same thing, and they begin as reflexes. So that's, does anyone else want to say anything from maybe a BMC perspective or any other system that you know about? Oh, and I see Sylvain there. Hi, Sylvain, and you have your hand up. So let's take Sylvain next. But is anyone going to comment on the reflexes and attention before we go there? Okay. Nope. So Sylvain.
Yes, thank you, Christine. Hello, everyone. It's wonderful to hear you again. And so I'm really curious about the appraisal component. And so my question is that where stand the what we call in the continuum, but also in probably in different other modalities, the inhibitors, the things that in our nervous system, in different layers of the nervous system, kind of filter the whatever experience we have.
Yes, absolutely. So one way to begin to discuss this very important idea of inhibitors is that in the brain, there are many areas of the brain that are devoted to movement. There's a lot of the brain that's actually devoted to movement, and one whole area of the brain is only there to inhibit movement. And so movement inhibition is actually so important that it has a whole area of the brain dedicated to it. And so one of the ways to think about it is that in order to perform any kind of movement, I have to inhibit other movement. And we see certain movement disorders like Parkinson's disease, for instance, and Huntington's chorea and things like that. What happens in the brain is that the movement inhibition area, the neurons in that area are dying. And so you see unintentional movement like shaking and the ability to inhibit another movement so that a certain movement can be centralized is there. And also, so there's different parts of the brain for inhibiting movement. There's also another part of the brain that all it does is initiate movement, right? And that we'll see there's movement disorders that involve that part of the brain too. And then there's a movement area that just sustains ongoing movement. And so my sense is that there's actually attentional work in all of those areas. And so both sustaining movement, privileging certain movement, choosing certain movement, inhibiting other movement, coordinating towards that movement. And so this inhibition area is one aspect of that. And the whole phenomenon from a sort of psychological level, I think, is that in order to choose something, you leave something behind, and you centralize or make figural something, and that again requires you to inhibit something else. Now, I want to see if this is answering your question.
Yes, yes, absolutely. But I was also thinking of the social, the environment, and the more the social component or the cultural component
Yes.
that plays out as well. But I guess
Yes.
it's probably the same idea of different part of the brain.
Yeah, but I think this is really crucial also, Siva. So for instance, in biology, they talk about what's the difference between a wild animal and a domesticated animal, a pet, right? Or a domesticated animal. And there's three things, and I don't think I can remember all three, but one is that you control the reproduction of an animal. You control whether or not it has babies. This is very important right now in the States, right? In the States, we're having people try to control women's bodies, right? Whether or not they can reproduce, domesticate women again, right? So that's my social comment there, and I'll just leave it at that. But one of the other ways that we domesticate an animal is to inhibit their movement. In other words, to say, you can move here, but you can't move there. You can do this movement, but not that movement. I really like it when you do this, my dog, and I don't want you to do that movement. And so a domesticated animal is an animal that it has movements that it has to inhibit. So we see this, for instance, in social situations with people of color in the States, where, for instance, African Americans will talk about that they have been trained to look down when they're with a white person and to make their body very quiet when they're around a white person. When a police officer comes up, you show your hands. So you make sure your hands are visible and nothing is in your hands. So culture trains movement as well. Culture inhibits movement as well as chooses certain movements, and oppression inhibits certain movements and privileges others. I did a research study, a qualitative interview study with a friend and colleague of mine, Ray Johnson, and we interviewed people in different identity categories, and they talked a lot about how they had to fundamentally change how their body moved when they were in one social scenario versus another social scenario. And of course, we all know this, like what it's like, how we move when we're with friends and relaxed, how we move if we're with someone who we don't know or who we're worried about or scared of. So it's that same quality of really getting how we inhibit and shape movement from social cues, which likely are trained very early. So does that also get at what you're interested in?
Yes,
Yeah.
yes, totally. Yes.
Yeah, good.
Thank you.
Yeah,
Thank you.
yeah. It's so good to see you, Sylvain. Silvana and I have seen each other in some conferences lately, so it's really nice to see you in this context. Okay, I noticed there's something in the chat says, Christine, is there any research on the, brain state and attention? So that was Sylvain too, but I think I might have answered that as best I could. So I know that we're at 11:30, so I want to respect our time boundaries. Does anyone have any last comments before we close today? Okay, well, I'm going to say goodbye now. I want to also, again, please ask you if you're going to sign up for a spring class, please do so right away, even if you don't pay yet, or just tell me directly or go through the website, either way. But I need to know in the next few days whether or not people are coming to classes because of enrollment and studio contracts and things like that. So Sabina, did you have your hand up real quick? And you need to unmute yourself.
So I just have a quick question because I think I signed up, but I didn't get any reaction from mail or something. So
Yeah.
I don't know if you got it or
I
if
didn't.
Rachel got it. So
okay, yeah.
For me, it was not clear. Did everything arrive?
Right. Thank you for that. So just to say, this is happening. We still have kind of, in English, we say bugs in the system. So the system isn't working exactly properly yet. And so if you haven't gotten any acknowledgement from me or from Rachel that you've signed up, please contact me, because not everything is getting through yet.
Okay.
We're trying to solve it. We're trying to identify what the issues are and then solve them. So
Okay.
thank you. Thanks.
So thank you very much for now. I enjoyed seeing everybody.
Yes, I so enjoyed seeing everyone. So adieu, farewell, ciao. Thank you so much. And if you want to also tell me other Zoom classes we might do. Okay. Bye.
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 Thank you.
Uh-huh.